Your doctor and your TSH test are both missing your thyroid problems. And by the end of this short video, you're going to have an understanding of one, why it is that conventionally trained medical doctors don't measure thyroid hormone correctly and why they are so reticent to help people to optimize their thyroid health. But more importantly, you're also going to have all the tools that you need to develop full agency over your health and to have a complete understanding of where you stand so you can begin to improve your energy and improve your focus and improve your moods and improve your metabolism. My name is Scott Resnick, and I'm a medical doctor. I've been doing functional medicine for the last 15 years. And I'm making these YouTube videos to simplify complex scientific subjects and to give you guys the tools that you need to turn around your health without using conventional drugs. And today, it's all about thyroid. Now, I remember my first day of medical school. This was in 1989. I know it was a long time ago. Almost seems like we were on a different planet. But I remember two things. The first was a national thyroid expert who came into my class. And in front of the medical students, he strongly stated that the only thing that you need to do to understand what's going on with the thyroid gland is get a TSH. If your TSH falls between 0.5 and 5, the thyroid function is normal and you're done. Now, we know today that this is anything which is there couldn't be anything farther from the truth, but so many generations of doctors have been set up with this missive for decades. And the other thing that we were taught, again, like the first week of medical school, is that a high thyroid state, hyperthyroidism, causes cardiac arrhythmias. And yes, it is true that when somebody gets profoundly overdosed by their doctor on thyroid hormone, or they have Graves' disease, which is a pretty rare autoimmune condition, the presence of high thyroid function can actually cause arrhythmias, abnormal cardiac rhythms. But what they don't tell you is that recent literature has shown us that a hypothyroid state, a low amount of thyroid function, can similarly cause the heart not to work well. It's kind of like an inverted U. You want to have the Goldilocks principle and the right amount of thyroid hormone. So let's assume your doctor just kind of, you went into your doctor saying, I've got cold hands, cold feet, dry hair, my thinking is foggy, my moods are off, my periods are off, I'm constipated all the time. And your doctor checks a TSH and says, oh, if your TSH is between 0.5 and 5, you're totally normal. Here's what you need to do. You need to go and get a comprehensive thyroid study yourself. And what you need to measure are these hormones. TSH, of course, that's a good start, but remember, that's just measuring what your brain is telling your thyroid gland to make. It's not measuring the actual levels of the thyroid hormone at your cells. The way you understand what's going on at the cellular level and what is driving your metabolism is to measure a free T3 and a free T4. And for those people who have been under a lot of stress, or they're currently using relatively high doses of levothyroxine, otherwise known as Synthroid, which is T4, these are conditions when we start to see an elevated reverse T3. And reverse T3 is kind of like T3's evil twin brother. It's kind of its doppelganger. So if T3 increases your metabolism, reverse T3 suppresses it. And the last thing that you need to get are anti-thyroid antibodies that are going to show whether you're having some degree of Hashimoto's thyroiditis. This is the anti-TPO, which stands for thyroid peroxidase, and anti-TG, anti-thyroglobulin antibodies. It's been estimated something like 1 in 12 people in the United States are manifesting antibodies to their thyroid gland. Now, in some cases, this is going to produce a relatively hypothyroid state, others not. But the thing to know is that if you are making antibodies to your thyroid gland, you're at increased risk for developing other autoimmune processes. So it might be a good time to start to look at some of the things that you can do to keep your immune system doing well and happy. And I cover that in other videos on this channel. It's important to remember that thyroid hormone falls soundly in the energetic strata of my health systems pyramid. This means to really understand what's going on with your thyroid gland, you also need to be thinking about your cortisol levels and your insulin levels as well, because these three hormones collectively work to manage energy in the body. And if you want to know where you stand from a functional health perspective, I mean, where are you on the spectrum of great health to moving towards disease? I've put together a really simple 5-question, 2-minute self-assessment at home, which is listed in the description below, and that's going to give you some insight as to where you stand from a functional health perspective. I'll see you there.